Hi, my name is Kimberley McCall. I am an upper limb physiotherapist working at Melbourne Hand Therapy. I'm going to tell you a bit about me today. So I initially qualified as a physiotherapist in Scotland in 2011. I worked as a rotational physiotherapist for the first 3 years of my career in a hospital in the NHS. And this really built the foundations of my career, just working in different departments and different wards, both inpatient and outpatient settings. Over this time, I developed an interest in musculoskeletal physiotherapy and I decided to move to specialise in that area in 2014. So from there, I started working in outpatient clinics, specialising in musculoskeletal physio in 2014 until I moved to Melbourne in April 2018. In addition to my NHS work, I also worked for a number of years with sports teams in Scotland. So I was the head physiotherapist for over 4 years with a soccer team, and I also worked with Scotland's professional basketball team, the Glasgow Rocks, for a year, where I would provide assessment and treatment during training sessions and also pitchside and courtside first aid and physiotherapy during games. So this really developed my skills in treating acute traumatic injuries and also in creating rehabilitation programs to allow players to get back to full training and full games. Since moving to Melbourne in 2018, I've predominantly worked in private practice, which has really further developed my musculoskeletal physiotherapy skills, but I've also started to develop an interest in treating the upper limb specifically over the last 3 years. And I've increased my personal studying to reflect this through courses that really focus on the upper limb. I moved to Melbourne Hand Therapy in May 2021, and this was really just due to this keen interest in working with the upper limb. So this role allows me to work with clients, treating an area of the body that I'm truly interested and truly passionate about. Now, the thing that I love most about being a physiotherapist is I just love getting to know my clients. I love getting to know what you're interested in, what your hobbies are, so that I can work with you to create personalised goals to get you back to what you want to be doing. In terms of my studies, I studied a BSc Honours degree in physiotherapy from Glasgow Caledonian University in Scotland. So I qualified with a first class honours degree. And then since qualifying as a physiotherapist, I've completed multiple courses to develop my knowledge and skills in different areas. And more recently, this has been tailored towards the upper limb. So I've completed shoulder physio workshops and also currently completing an online shoulder course just to continue developing my specialty in that area. I've also just completed the first year of a 3-year Masters in Advanced Practice. So this Masters focuses on the development of advancing physiotherapy practice within 4 key areas. So that's developing my clinical skills, leadership, evidence and research, and facilitation of learning. So completion of this course in 2023 will really allow me to become much more developed as an advanced practitioner, both clinically and non-clinically. The thing that I love about working with Melbourne Hand Therapy is I just love working with such an incredible team of highly skilled practitioners. And they're also welcoming and so assisting of my professional development, which really means a lot to me. And I also really enjoy the fact that Melbourne Hand Therapy work closely with a number of surgeons, so we get to see a lot of patients post-operatively, and I really like getting involved in that side of the recovery for patients to get them back to normal after their surgery. The values that drive me, I am a highly motivated person, and I place high value on learning and on growth, which I think is important for professional development and integrity. I also value kindness and compassion, and I think in my opinion, these are essential qualities as a physiotherapist because we are trusted to treat and care for people. When I'm not at work, I do enjoy keeping active because I like to tell my patients to keep active and I like to get them working through their strengthening and rehabilitation. So I practice what I preach and I go to the gym and I enjoy exercising. I also wanted to learn something new, so I'm in the process of taking up golf lessons to try something new this year, but I'm very much in the early stages of my golfing career. And if I'm not doing something active, if I'm not at the gym, then I can just be found relaxing with a good book and maybe a nice glass of wine.